Hi, in this video we'll talk a little bit about inflammatory bowel diseases and compare and contrast the two conditions associated with IBDs, or Crohn's disease and chronic ulcerative colitis. So just a little bit of information about prevalence rates of these diseases. So if we look at Americans, about 1.6 million Americans are estimated to have IBD, so it means that they have either Crohn's disease or chronic ulcerative colitis, or CUC. A significant proportion of those cases are actually children, and there's new cases that are being diagnosed each year. So both of these conditions can affect the gut and cause some serious GI tract symptoms like abdominal pain, diarrhea, and bloody stool. And those symptoms can kind of come and go. So they have periods of flare-ups where you have really bad symptoms, and then periods where you're asymptomatic and you're not feeling them. Those symptoms can often be triggered by certain foods or other environmental factors. So part of managing the disease is understanding what the triggers are so that you can avoid those triggers and prevent symptoms. What we're going to talk about now is just kind of comparing and contrasting these two conditions and how they affect the gut. In particular, we're going to talk about which parts of the GI tract are affected, how the diseases are affecting the GI tract wall. Okay, so if we look first at the location, in Crohn's disease, the inflammation can be anywhere in the small or the large intestine. It's often found in the ileum, which is that last part of the small intestine as that GI tract is transitioning into the colon or the large intestine. But really it can be anywhere in the small or large intestine. And in Crohn's disease, we also see these skip areas, which are these areas that are not affected by the disease, sandwiched in between these areas of inflammation. Okay, so they're called skip areas because it looks like the disease has skipped that part of the GI tract. In contrast, in chronic UC, the inflammation is only found in the colon, and it often starts in the rectum and then moves and spreads proximally, right? And unlike Crohn's disease, we don't see these skip areas. So it's one continuous area of inflammation that we see in the colon. Other ways that we see differences between these two conditions, in Crohn's disease, the inflammation can affect the entire wall of the GI tract, right? So transmural means that it goes across the entire wall. So it could affect all 4 layers of the GI tract, from the mucosa to that outermost serosa layer. In chronic UC, we're only affecting the mucosa, so we're not really seeing any effect in the outer layers of the GI tract wall. The other big difference between these two conditions is that in Crohn's disease, the inflammation leads to scarring. So we're getting some fibrous tissue that's forming, and it's actually making the intestinal wall thicker. In some cases, the wall can become so thick that it starts to obstruct the bowel, and that can be a major problem for our GI tract function, and it needs to be addressed, often surgically, where you're removing that obstruction of the GI tract. In chronic UC, we have the opposite thing happening. So we're forming these ulcers, which essentially is thinning of that mucosa layer. So that mucus lining the epithelium wears away. We expose the epithelial tissue to the GI tract lumen, and we start to get wearing away or thinning of that mucosa or epithelial layer. And just to visually see what that looks like, here we have images from colonoscopies where you can see what our normal colon looks like compared to diseased colons. So in Crohn's disease, you can see that scarring and that thickening of the GI tract wall that's occurring versus the thinning and the ulceration that's happening in our chronic UC. All right, so just to wrap it up, both Crohn's disease and chronic ulcerative colitis are forms of inflammatory bowel disease, where we have this chronic inflammation present in the intestines, but they're affecting the GI tract in different ways. All right, thanks for watching.